haven't felt this good since I was 75.
Yeah. I'm Judy Gallemore, and my husband and I live in Walla Walla, Washington, and we're real happy to, both of us, come down here all the way from Walla Walla. We came down here because Bob had a necessity to see a cardiologist.
So I'm gonna get your room and we're gonna get some vital signs on you, okay?
We came in and Bob was talking to the doctor, and then it was my turn, and I started explaining that I'd had some chest pains, what have you. They immediately realized I'd had a heart attack and put me into the hospital.
The Gallemores were great patients to treat. I've only treated 2 patients in a family once before.
Let's go for a 97
Yeah.
degree.
Hi, I'm Robert Saied Farivar. I'm the Medical Director of Cardiothoracic Surgery at Saint Alphonsus Medical Center. Ms. Gallemore needed a TAVR, which is a transaortic valve replacement for aortic stenosis. This is a procedure in which you go through an artery and a vein and you put a new valve into the previous aortic valve. So this is an advanced procedure that's done minimally invasively with our cardiology colleagues.
After that, they had been checking on Bob and realized that he needed some attention.
Mr. Gallemore needed a much more complex procedure.
But they discovered that I had a dire need for not only a valve replacement, but also my aorta needed to be replaced.
He needed something that's called the Bentall procedure. He needed it because he had a similar disease, but he also had aneurysmal disease. If you let an aneurysm get bigger, it's sort of like a balloon that gets bigger, and eventually it'll pop. And that causes a lot of problems.
We spent 2 or 3 months down here back and forth.
It was done in a short window between the patients. Like, I could actually see them down the hall talking and referring as they came down here. So we're a very modern program. We tend to get patients in very, very quickly. We don't let patients sit for weeks and weeks and weeks stewing on the diagnosis and reading the internet and coming up with their own treatments and diagnoses. We actually get to them quickly.
He was very attentive to what we needed and was really on top of it. We didn't have to question whatever, although we did have questions and he was quick to answer those for us. But it was obvious that he knew what he was doing and seemed far superior to anybody else that we had ever gone to.
It was really fun to treat 2 patients and to have a great outcome and feel very satisfied that this family was going to be able to go into the next stage of their life taking care of all of their cardiac surgery problems.
We would not have known where to go to get this kind of treatment. And I think we're really fortunate to have him this close, even though 4.5 to 5 hours is a jaunt, it's still close for us, and we're grateful for that.
I am exceptionally thankful.
Yes, yes, we both are.
A godsend for us.
Yeah, yeah.
And that's a fact.